Good morning. This is Dr. Marshall here at Medical Specialty Clinic again, and today I would like to just talk real quick about probiotics. So recently I've had several patients ask about what is a good probiotic, what should it contain. So I wanted to just give you some ideas on that. Little healthcare disclaimer, obviously this is not direct medical advice, so anytime you decide to take a supplement, a vitamin, a medication of any type, always discuss that with your individual healthcare provider. This is just a basic discussion for informational purposes. Although if you would like more information about anything in the video, we would be glad to talk to you. Just give us a call here at the clinic, check in with us on our website. You can email us. I'll put some links in the description on how to get in touch with us. Getting into the meat of the video here. So probiotics, they're really not all that complicated. They are just healthy bacteria that you take. They remain stable in the stomach, so they're not killed by the stomach acid, the high acid content in the stomach. They make it through to the small intestine, and there they help us digest food, they help us break down materials, and they actually help produce some vitamins, some minerals, some amino acids that we need from the environment, things like that. So they can help quite a bit, can be very beneficial, and they help keep us regular. A lot of people deal with constipation or diarrhea that causes problems, and it's usually a result of difficulty with the standard American diet that causes problems. So a lot of highly processed foods that our gut just doesn't deal well with, and it changes our normal microbiome, or the normal set of bacteria and yeast that live in our intestine and that we have to have. It's a symbiotic relationship. The probiotic that I recommend is one that contains a few species of lactobacillus and a few species of bifidobacterium in combination with some Saccharomyces if possible. And there's different amounts of these. If you look, there will be different colony forming units. So that is a measure, a standard on how much of that product and what amount of bacteria will make it to the digestive tract. So CFU, or colony forming units. And basically just general supplementation. You're not having any major problems, you just want to try and be healthy and maybe a little more regular, then 20 billion CFU, or 20 billion colony forming units, is a good place to start. And then if you have other medical problems, it really can help to supplement. If you are currently taking antibiotics, or if you're trying to get rid of a yeast or candida or candidal problem, so if you're trying to get rid of some yeast overgrowth, or if you're on antibiotics for an infection, then it always helps, because antibiotics will kill off some of our normal healthy bacteria, as well as some of the problem causing bacteria. Usually antibiotics can kill the healthy bacteria and let the ones that cause more trouble stay around. They're a little more resistant to it, and that can cause a lot of trouble. 20 to 50 billion colony forming units for that if you're on antibiotics or trying to get rid of yeast overgrowth. If you have more severe GI problems, so if you have inflammatory bowel disease, not irritable bowel but inflammatory bowel disease, that would be ulcerative colitis, Crohn's. Supplementing 50 to 200 billion colony forming units would be a good idea. And there's some that actually come in a little bit higher dose. The Saccharomyces, which is a yeast, 5 to 10 billion colony forming units is not a bad number to look for, and that would also be during antibiotic therapy to kind of help prevent candida overgrowth. There's also some other products that you may have seen that have spores in them, or spore forming. So there's a few types of bacteria that form spores, and they're very resistant to environmental changes, heat, chemicals, antibiotics, things like that. A spore basically is a thick coating around the bacteria, and it can't be killed. And then when it gets into a favorable environment, it opens up and starts reproducing. But there's a few different types of bacteria that form spores, and they can be particularly problematic. C. diff, or Clostridium difficile, is one that you probably have heard of, and that's one of the reasons it's so difficult to eradicate, is because it's very hard to kill those spores if they're around, and then it can come back. So for that, the healthy spore forming probiotics that you could take, typically you'd want to go with about 4 billion colony forming units on the healthy spore forming supplements. to help with a dietary supplement. But usually you only need those if you have real severe GI problems, small intestinal bacterial overgrowth, or SIBO, S-I-B-O. I'll let you do your own research on that, but that's an up-and-coming disease that we're trying to learn more about. SIBO, S-I-B-O, small intestinal bacterial overgrowth, and that's causing a lot of trouble for people. So if you think you have more problems than you can take care of with just probiotics, then by all means give us a call. We'll be glad to talk to you about that. I hope this helped, and I will put a little blurb up about one that we carry in the office. So we sell a product here from Orthomolecular Products that I think is a really good probiotic, and it comes in different colony forming units. I'll list those. I think there's a 100, and then there's a super high dose 225 colony forming unit product. It also comes in a powder you can mix with water and drink if you don't like to take the capsules. I think they make a good product, but that's certainly not the only one out there. There's hundreds literally of products of probiotics. But again, lactobacillus and bifidobacterium, it should have a few different species of those in it, and the Saccharomyces is not a bad addition. I think just as an example, some other products that you can find online, I think Doctor's Best carries a product that's pretty good. They have a similar option. If you have any questions, please reach out to us. We'll be glad to talk to you about it. Thanks for tuning in to the video. We look forward to seeing you in the next one.